Hey, welcome back to Not Today Club Two Breasties Fudge Cancer. I'm Anitra. I just wanted to go over some information regarding skin anxiety and maybe some tools or things that you can help you going through learning about it. Skin anxiety is underreported. It's an issue that cancer patients have that they it's really underreported where you don't go about speaking with your healthcare specialist, your oncologist, or the people at the center, that you seek attention to get the help that you need. So it's underreported. It can be paralyzing. It can kind of stop you in your tracks before week or two before you have to have a test done. So it is something that's paralyzing. It kind of goes about it messes with your mind and your ego, put fear inside of you. So just to know that you're not tripping or you're not crazy. So you are having some fear due to anxiety. Some things that you can learn about how to deal with is coping behaviors, what to do when you have it, and coping attitudes, how you think about it. You can have rituals or do routines. If you're scheduled for a test, you should possibly get your test done, scan it early in the day so you can kind of have it and get it done and get it over with. And, and don't be so quick to look at your test results to get the test results back. It's best for you to wait and talk to your provider and go from there. And you can also talk to your family because if they're kind of like asking you, but it's kind of making you anxious, you can kind of express to them that it's really bothering you by you having a fear of having a reoccurrence of your cancer coming back. So it's good to let your family members know how you feel and what's going on with you. If you can tell them verbally or write a letter to kind of help you calm down, to kind of deal with, what's going on with you. Because sometimes you may not want to share the information right away, or sometimes you might not even want to know the information. So just to know that anxiety is real. Some other things that you can do dealing with anxiety is normalize it. So just know that it's normal. Sometimes distractions can be good, kind of staying busy, keep your mind occupied where you won't have a lot of time to be able to focus and think about it with the fear. You can have positive self talk. Faith and prayer works. That's what I do to kind of help me deal and go through what I'm going through. I just surrender and gave it to God, and I deal one day at a time. And also by me working as a nurse assistant, I taken care of a lot of patients who had cancer, who was on their deathbed, or people who had different disabilities. And I looked at what I did to care for them, and I watched how they lived their lives, and so they gave me motivation and encouraged me to be able to do what I need to do for myself. Another thing that probably can help you is staying active. Coping attitudes can be seek out information. Uh, Some other things you can do is gentle movement, stretch, walk, or dance. Journaling help, journaling, coloring. You do abdominal breathing and affirmations. Just be prepared, gain awareness, and what triggers you. So you need to find out the things that trigger you. So that's a good thing to help you deal with it. So when you know it's time for you to have to get your scan, so you know that's a trigger. So it's good to let your family know, the people that's close to you, so they can kind of have an idea. So if you start acting out of the ordinary, they'll know exactly what it's from. Also, I'll just share some things with you about what patients said about it, which are you should find your voice, advocate for yourself. Try to learn how to be in a position where you can speak up and say what you feel. Don't hold it in. Uh, you can turn to help, bring a trusted support person with you. So if you're really on the verge, it's nothing wrong with getting support, getting a buddy, a friend, or a loved one to go with you. Have somebody there to help you like fight the battle. Don't try to do it all alone by yourself. Also, you can ask for clarification if you don't understand something. So if you leave out puzzled, unsure, that's why it's good to have somebody to go with you because two sets of ears is better than one set. Because sometimes when you're going through things or when you had chemotherapy, sometimes it's like you hit and miss when you hear information presented to you. It's like you hear bits and pieces. Like you don't hear the whole sentence or the whole word. So it kind of have you confused.